close the care gap. This morning, we're having someone who's very experienced in the field to talk about cancer, that dreadful, monstrous disease that almost seems not to be going away. So we'll break down what World Cancer Day is meant to achieve, what close the care gap entails, and how we can close the care gap in Nigeria. And my guest is a consultant clinical and radiation oncologist at NSIA-LUTH Cancer Centre. That is the Nigeria Sovereign Investment Authority, the Lagos University Teaching Hospital. Thank you very much. You heard his voice already. His name is Dr. Chidi Agakwuru. Did I get that correctly?
You got it spot on.
Thank you very much for
Well
being
done.
here.
Well done.
And welcome, and most importantly, well done for all you are doing in cancer care in Nigeria, Africa, and generally. Thank you. So let's get started. Exactly. I think I don't know if we should start with defining what cancer is, because I just feel everybody has an idea of what cancer is, but not to assume. Let's go back to the basics. What exactly is cancer?
Okay. Good morning, Lagos. Thank you for having me. Like you said, I'm Dr. Chidi Agakwuru, consultant, radiation and clinical oncologist at the NSIA-LUTH Cancer Centre. And every 4th of February, we try to talk about cancer, try to bring information about cancer to people. So back to your question, you asked what cancer is. So I'm trying to make it as simple and understandable to the layman. So cancer is basically an abnormal growth of cells. So we as humans, we grow by multiplying at the cellular level. So cancer is what happens when the multiplication is completely lost control. The body can't say, hey, you stop there, stop at this limit. It just goes on and on and on, replicating. So that manifests as cancer in the physical.
All right. And pulling up the data, it's not pretty at all. According to the World Health Organization, it says that cancer is the second leading cause of death globally, which accounts for an estimated 9.6 million deaths. That is 1 in 6 deaths. That was as at 2018. And we have different types of cancer. We have lung, we have prostate, colorectal, stomach, liver cancer are the most common types of cancer in men. While, well, in women, breast, colorectal, lung, cervical, and thyroid cancer are the most common in women. But from your experience here in Nigeria, what has it been? What has the data looked like?
Okay, so I want to come back to what you said about cancer being the second leading cause of death. That is true. But you, to understand and to have some perspective on it, about 15 years ago, it was about the fourth. So
Whoa.
not only is it second, it's a very, very rapid climber. It's only second to cardiovascular diseases, that's heart diseases, heart attacks, and cardiac arrest. These are things that have been at the top for a really long time. So cancer is climbing, which means that the incidence is rising. For some cancers, though, some have plateaued, but most of the incidence is rising. Bringing it down here to Nigeria, before I quote Nigerian statistics, I have to put a caveat that these statistics are probably underrepresenting what the true story
Definitely.
is, because I mean, you know how we are with numbers. But looking at the statistics from 2020, you have to understand that the incidence is the number of cases you have over a given period of time. So mortalities are the people who die from those cases over a period of time. So in 2020, among men, the most common cancer is prostate cancer, then you have colorectal cancer, then you have non-Hodgkin's lymphoma. And in women, you have breast cancer, cervical cancer, and then non-Hodgkin's lymphoma. But the statistics vary from different geographical regions.
Yeah.
Like in the US, you can't see cervical cancer as high as second in women. This is something that they've dealt with, they've eradicated, and they've nearly completely eliminated from their health system. But it's still up there in Nigeria, and it's thriving, and it's wreaking a lot of havoc.
Okay, I think we already started by touching on that. I think that is a care gap. That is a gap. The one, how they've been able to deal with cervical cancer in the United States, for instance, or in the European countries, and how here in Nigeria it's still killing people. I think the second next to breast cancer. So what is going on? Because I know you can be vaccinated.
Yes. So talking about the care gap, the phrase you just brought up again. So closing the care gap was the theme last year, and it will remain the theme for a couple of years because it's really crucial. If you look at the history of the themes that have held for several World Cancer Days in the past, You would see that between 2016 and 2018, it was we can, I can. These are phrases that try to bring people together. And if you look back a bit, you can see in 2015, it was not beyond us. It tries to make people believe that this is not a death sentence. It's something that can be surmounted. So now this year, we're seeing close the care gap because you will be shocked at the disparity in access to care that different categories or groups of people have. Just for the fact that you're living in Nigeria and you have cancer, your outcome is completely different from someone who's living in another country. And you might have the exact same kind of cancer, but the disparity is different. Your outcome is really poor. So let me give you some fun statistics. So you look at childhood survival rates. That's the number of people who make it through diagnosis, treatment, and survive. Childhood survival rate is about 80% in high-income countries and 20% in low-income countries. That's about a 60% gap. Then you look at something about the differences in outcomes between rural and non-rural areas, really high. So despite the fact that you might be in a high income setting like America, or you might be in a low to medium income setting like Nigeria, the difference in outcomes when you're living in the rural and when you're living in the urban areas is always very, very great, especially in Nigeria here, where the urban-rural divide is more pronounced than ever. So these are issues that we have that cause these gaps to be there. In Nigeria, people are basically suffering and looking for a way to better their economic statuses. Then you're talking about them treating themselves for cancer. One cancer diagnosis can send an entire family into the lower rungs of this economy. So it's a big problem. Yeah.
We'll definitely zoom into that after this break. You're listening to Soul Food here on Smooth 98.1. We are talking about closing the care gap against the backdrop of the World Cancer Day. My name is Oluwaseun Olusegun, and my guest is Dr. Chidi Agakwuru. Please stay with us.
Everyone is covering the support. Stay tuned to Smooth 98.1.
How much longer do we have?
Love life.
20 minutes.
Okay.
Ladies and gentlemen, have you ever looked for that opportunity to prove to yourself that you can always keep your eyes on the goal
So any
and never
direct
ever
questions?
stop
Okay.
until
can
you
spend
reach
the
it?
remaining
Or
20
maybe you
minutes
belong to the
actually
feet
saying
fam
things that people
category,
can
but you're
relate to.
looking to
For
step up a
example,
notch
you
higher
can ask
and
me if
run,
cancer is
crossing the
preventable.
extra mile.
Yeah.
Well,
Really
you got
crucial.
an
Which
opportunity,
of these
an
cancers can be
amazing
prevented?
opportunity at that,
What
that can
screening
even
is,
reward you
and
while
I'll
you
talk
have
about,
fun and chase
screening and
that
risk
dream.
reduction.
The
Mm.
8th
Then also,
edition of the
we
Access
need to talk
Bank
about what
Lagos City
progress looks
Marathon
like. I
is
mean,
set
what
Oh
to
yeah,
take
progress.
place on the
those
4th of
are the
February
question. The truth
2023.
is,
And remember,
I
you
was
have
going to ask, which is
exciting
maybe when we
prizes
come back,
that
we'll
will
start with
reward
that.
your
Where
passion,
exactly are
your
we? There have been
tenacity,
many
and
times
your
we
drive
sometimes
to
see
never give up.
publications, news
So,
articles
it's
saying,
time for
okay,
you
there is now
to
a
gear up,
breakthrough in terms
lace
of
up,
cancer
literally,
diagnosis,
and
early
get your
This is not
prevention.
trainers
Nigeria.
and hit the road.
Globally, but
You
then
can
where are we in
participate
Nigeria?
in either the
Okay.
10
Are
kilometer
those
or
things?
the
Because that's part of the
42
care
kilometer
gap.
marathon races. The 10
So
kilometer
they are
race
making, so people are
commences at the
rejoicing and
Great
saying,
Sports
oh,
Garden
finally there
event
is an
space
AI
in
that can
Durosimi
probably prevent
Etsy.
or cut
That
down
is
the
in Lekki phase
metastasis.
1.
But where
But
are
if you're
we in
looking to
Nigeria?
push yourself
And that's one
further,
of the reasons I wanted to talk
the
to
42
you or one
kilometer
of the
race
persons
will
from
begin
NSIA,
at
because
the
I feel you
National
are the
Stadium in
forefront of
Surulere.
this.
Now head
So
out there, go the extra mile, and cross the finish line all the way to victory. And you can be rest assured that the rewards will be waiting for you. The marathon is organized not only to promote health and fitness, but also to highlight the athletic talent within Africa and showcase them to the world, which you could be part of. So, what's your excuse again? What are you waiting for? This is your chance to win the ultimate prize. Meet great people, support charity, and just have a great time. You can find more information about the Access Bank Lagos City Marathon at www.accessbankplc.com/marathon. So, are you ready to run? If yes, go out there and make this marathon a date to remember. Whose world is it?
This is a woman's world.
Let's talk about the woman. Women make up more than half of the world's population and potential. Let's talk about gender bias, relationships, and careers. Let's talk about the woman.
For the record, feminism, by definition, is the belief that men and women should have equal rights.
Pancreatic cancer is one of the deadliest.
A story
Why is
about
that?
her journey
You
to
don't
being
talk about
a
it all.
hero.
Yeah, up there.
When
Because
I was
it mimics
just
so many other
11 years
conditions.
old,
So
I
by the
became
time they
a
find
female
out that it is
advocate.
pancreatic
Smooth
cancer, it's already
98.1
advanced.
presents Soul Sisters,
Surgery
a
is so
discourse on
complex.
the
You can't even
woman.
reach the pancreas.
Now
It's like
on
embedded
Smooth
under so many organs.
98.1 every
So-
Wednesday
We are definitely
from
talking about
11
this on air.
a.m.
Yeah, sure. That's what kills Steve Jobs, actually.
Smooth.
Steve Jobs dies from pancreatic cancer. What are your chances, really?
Smooth 98.1. Love music, love life. Be a part of the conversation. We are talking about cancer. And yes, I know it's an ugly disease we do not like to talk about, but we need to talk about it because information is key. Most times when you search online and you're discussing cancer, you will see that early detection is key. So for you to have early detection, you need to be aware of it. That's why we're talking about World Cancer Day, Close the Care Gap. And with me in the studio is Dr. Chidi Agakwuru. My name is Oluwaseun Olusegun. You can join us on YouTube or you can decide to call 014489981 to ask your questions. Again, 014489981. So before the break, before we came back on, we were talking about pancreatic cancer and the different kinds of cancer. Let's get okay. We have different kinds of cancer.
Yeah, we did.
And we actually, like I mentioned, early detection is key. But first, you already told us about the disparity in the ones that affects mostly the men and the women. So let's talk about screening.
Okay, before I get to screening, I want to reiterate that World Cancer Day is a day where we take our time to do three things in terms of cancer specialists or oncology nurses or therapists, everyone who is involved in cancer care. We take our time to do three things. We try to do three things. Okay, first we try to target misinformation. That is very, very crucial. In Nigeria, the Nigerian healthcare system sometimes can be crippled by misinformation. People don't know what it is. People don't know how to approach it. And by the time they come to terms with what is really going on, you have a late stage presentation. Second thing we need to do is raise awareness that, look, people bandy the phrase that, cancer is a death sentence. It is not a death sentence. I mean, you can't even say that because almost everything could be a death sentence. I mean, walking out onto the road to jog, you could just get hit by a car and you're gone. So I think what a death sentence is when you're in a society that doesn't pay so much attention to healthcare, that is a death sentence. So we are not going to subscribe to that. That is not true. And thirdly, we need to reduce the stigma because there's a stigma associated with cancer care. Some people come and ask you, can I catch it? My mom has it. Can I let her carry the baby? I've heard that before. And you're wondering what happened to these people's internet connection. You need to check these things out and understand that people in other countries have moved past these cultural barriers and stigmatization of people. So when you're talking about screening now, that's elementary stuff that other countries have moved past. But in Nigeria, for the best efforts of people who are trying to do these good things and NGOs and all that, we still haven't gotten to all the populations that need to be served by these screening facilities. I mean, we know what the population of Nigeria is. We're talking about between 150 to 200 million. And the screening efforts of just a couple of people isn't going to help. So there needs to be a concerted effort by the government. In some countries, when you turn a particular age, they call you in for your screening. They call you in to have your pap smear. They call you in to have your evaluations because the system works. But in Nigeria, you're basically just, hoping that you don't have it and praying that it's not your portion. So first things first, we need to understand that there's a problem. It's a health emergency. We talk about people falling into poverty every day. Have we really thought about how these people fall into poverty? I've seen people fall into poverty just by the mere fact that they are paying for care out of pocket. And it really, really is something that needs to be looked into.
All right, thank you very much. So let's go to the different kinds of cancer, and they are definitely time cannot allow us to fully take it, but then the different kinds of cancer and their peculiarity. I mentioned earlier, I'm very interested in that pancreatic cancer because according to the data, yes, we're going to go there, doctor.
Okay, sure.
According to the data, it says that it's one of the deadliest cancer. So what's the data looking like here in Nigeria? Do we have a lot of it here?
Okay, in terms of, we'll talk about pancreatic cancer, but the ones that are affecting us directly. So pancreatic cancer, for all its evils, it has a very high mortality, but the incidence is not as high as the other big five that we talked about. And these big fives we talked about across both genders are the ones you look around and you're sure you've seen them and you continue to see them regularly. Breast cancer, prostate cancer, cervical cancer, colorectal cancer, and lymphomas. However, when pancreatic cancer does happen, the issue here is diagnosis, because we talk about spreading awareness and information, but we also even need to do that within the health sector, because non-specialists might see somebody come in with an abdominal pain and the default thing is to treat them for ulcer. I mean, these ulcers are not as common as we think they are. And, you know, for the fact that the symptoms of pancreatic cancer mimic a lot of other symptoms, you have this vague uneasiness, you have the pain in your center of your tummy, radiating to the back, and, you know, you're just losing appetite and losing weight. Or they tell you have cancer, you have ulcers, and you take ulcer medications for a month, and it's not letting up. You take it for another month, it's not letting up. But the person doesn't realize that they actually do have a pancreatic cancer. The challenge with pancreatic cancer is that the organ itself is so embedded within several other organs, the small intestine, the stomach, and to even access it for a proper curative surgery is so complex. It's every surgeon's nightmare. So not only is the diagnosis quite complex, but even the treatment is difficult. I mean, if Steve Jobs could die from pancreatic cancer, you think about the chances of the regular guy who has pancreatic cancer. So it's a terrible, terrible disease.
We seem to be having, I said last year, I think we came across some groundbreaking research some groundbreaking research in cancer, and how we have some drug that might boost immunotherapy, or that could increases the positive outlook of chemotherapy and all of that. But that is in America, that is in the UK, that is in Europe. Where are we when it concerns cancer care in Nigeria?
Okay, so where we are, we need to look at where other people have been and people who have been in our situation several years back. So in other countries, in developing countries, they've gone as far as splicing the DNA and checking your genes for mutations that would make you susceptible to cancer. They look for drugs that are targeting the receptors on the cancer surface cells. And for you to find these things out, you have to do a lot of molecular testing. They're even at the level of using radioimmunoconjugates. That's drugs that are a conjugation between radiopharmaceuticals and immunotherapy. I mean, this is wonderful stuff, and that's why you see that their mortalities are dropping. Although their incidences might be rising because of their lifestyle, the mortalities are either plateauing or dropping. So back in Nigeria here, yeah, these targeted therapies and these molecular therapies, they also work on Africans. But first of all, can you afford to even do the tests that will show if you're eligible for this? When you tell someone how much it costs to do a proper gene panel, it's so discouraging. Then even if you do the proper gene paneling and you want to pay for the drugs, that's the point where you find out that your also glorious health insurance plan doesn't cover anything, and you have to pay out of pocket. So we're talking about drugs that cost about 6 million naira, 6 million naira a pop. By the time you take those drugs for about 2 months, you're selling your property, and you know how much good will really do you. So most of the time, people are still trapped in the area where they have to give chemotherapy. I mean, the world is moving away from chemotherapy, except for a couple of cancers. So people have to give chemotherapy, and with the associated morbidities of chemotherapy and all that. So we need to be moving away to targeted therapy, but who's going to fund it? Who's going to pay for it?
I remember when the NSIA-LUTH was commissioned, I think one of the aim of the project was to provide those radiotherapy and other form of therapy for cancer that were not really available in Nigeria. And also another one, I think, was to deliver care to about 3,000 patients in a year. How is that going?
Oh, you know, it's we like to always bring in some religion into every phrase that we use to describe our daily life. So I would say it's a godsend that the NSIA-LUTH Cancer Centre currently exists, because prior to that, Nigerians used to travel abroad for stuff as little as even just teletherapy, that's radiotherapy with external beams. They used to travel for basic things that would break your heart. Yeah, there were a couple of radiotherapy services back then, but they were epileptic. you could start your treatment, and before your treatment is over, the machine breaks down. And the disease, once it's primed by treatment and you don't follow through to the end, its comeback is going to be really terrible. I tell people that cancer is not just a disease. It's like the villain from a sci-fi movie that comes into your DNA, learns about how you function, and it also adapts. It changes along with you. It's like a shapeshifter, and it's so terrible. So the NSIA-LUTH Cancer Centre is a godsend. Started out in 2019, and there are several facilities that we didn't have hitherto. 2 linear accelerator machines, 3 linear accelerator machines, forgive me for that, 1 high dose rate brachytherapy machine. These things were not here in Nigeria at any point, and people would travel abroad to get all these facilities. But now they're here, and if you look at the numbers of patients who have been treated since its inception, you'd say, a pretty good job has been done. About 6,000 patients who have gotten successful chemotherapy, about 4,000 to 5,000 patients who have been treated with teletherapy. The numbers are climbing even as I speak. And for brachytherapy, which is something that was introduced about 2 years ago, close to 1,000 patients are being treated. So it's a huge success story. And the most important fact is that the machines don't break down, because we have a maintenance culture problem in Nigeria, where you can build a fancy institute, and 2 months later grasses are growing in the offices. But these machines are machines that have always been serviced, parts have been replaced, and there's technical support for up to 15 years. So it's a great one.
How close are we in putting affordable in the same sentence with cancer care in Nigeria?
So it has to start from the very top. If you look at the monies that are budgeted for health in our budget, you're hard to break, and you wouldn't know where to start. And we don't take our national health insurance scheme seriously. It's a blessing to be healthy in Nigeria. You really don't know what you have when you have your good health, because when you have a malady or a condition that requires continuous care, you find out that your health insurance can leave you high and dry, and they just say, oh, we can't bear past this. And cancer care is something that might run for up to a year or 18 months. You can't have affordable care without the government coming in to enact policies and increase funding. Most importantly, increase funding, allow the space to be opened up for private organizations to come in and see how they can fund cancer cares. If there are more centers like this, obviously the prices would drop, but the throng on the few centers that are there, they actually exhaust those resources and make running the place really difficult.
Well, we'll take our last break, and when we come back, since it looks like affordability and cancer care is not very much in the same sentence yet, maybe we should talk about prevention and how you cannot, or you should try to not get into the situation where the care will dig a hole in your pocket, literally. You're listening to Soul Food here on Smooth 98.1. Stay with us, we'll be right back.
So how do we want to finish?
We have 4 minutes more.
How do we want to finish?
Just prevention and how you can keep healthy, even though it has been said that, according to you guys, we don't exactly have specific things. We just have risk factors for cancer, right?
Barricading your mind.
That's a
All you
bit
need
simplistic,
is a
but
moment of
when you're
courage,
preventing, there are a couple
of
of ways you can
confidence,
prevent.
the self-belief
That's what I'm
to push
Information
your
dissemination
limits.
is a mode of
It
prevention, letting
starts
people
with
know.
the first step,
Screening,
and
the
then
eligible
the next.
population,
So,
risk reduction also.
make it count.
Yeah,
Now,
there's some ways you
move.
can
Keep
identify.
going. Keep running. Keep the end in sight. And never quit. Don't stop till you cross the finish line. These are the moments to live for. Keep moving forward.
Get ready to go beyond the limit at the Access Bank Lagos City Marathon 2023 on Saturday, February 4th, 2023. Learn more at www.accessbankplc.com/marathon.
Access, more than banking.
This is the smooth voice of Dikbo on the smoothest dial on international radio. Smooth 98.1. Love music, love life.
And we love you for listening. Thank you for being a part of the show this morning. Soul Food is what you're listening to here on Smooth 98.1. My name is Oluwaseun, and my guest this morning is a consultant radiation A radiation and oncologist. How did I mix that up?
It's radiation and clinical oncologist.
Thank you very much. Exactly
Yeah.
what he said. His name is Dr. Chidi Agakwuru. So far, I think I've been doing well with your name, right?
Yes, very well, very well.
And we have been talking about World Cancer Day, closing the care gap. So before the break, I said when we return, we will talk about the prevention and just how not to get to that part. Even though, like I mentioned, we are not quite sure. According to the layman is not quite sure of the things that cause cancer. But from your enlightened point of view, how can we prevent?
Okay, so the different cancers, they vary in their pathogenesis and even the way they run their courses. So when you talk about pathogenesis, you talk about how it actually comes into the disease state, So there's an interplay of several things. You could have risk factors and you could have genetic susceptibility. So we know that there are several genes through which cancer mutations can be transmitted through the progeny. And the fact that someone doesn't have it doesn't mean they can't transmit these genes. So the first thing is, when you identify somebody who has a cancer that is known to be transmittable via the genes, you have to do the gene studies for this person. So you identify the relatives and make sure that they are put on early screening programs. Very key. Then information dissemination is also key. You have to let people know what to look out for and how to recognize if they are having any issues or if they are at risk for these issues. Then there are some cancers that are screenable. Cervical cancer is top of the list. We talked a bit about how other countries have completely moved past this. So we know for sure that cervical cancer is caused to a very large extent by particular practices. And the human papilloma virus is sexually transmitted. It's been implicated in cervical cancer. So safe sexual practices, for one, will be a good way to limit some cancers. Several cancers, even the cancers of the mouth, cancers of the anus, cancers, all over the body, they are implicated with some viruses that can cause them. But screening programs for cervical cancer, important in women. So you have to identify these women when they get to a particular age. You have to test them for the DNA virus, and if they don't have the virus already, you have to administer these vaccines to them. But these vaccines are quite expensive, so it's something the government needs to look into and make them completely free. Then there's also the point of risk reduction. So we have identified several risk factors with several cancers. We know that obesity is a high risk factor for several malignancies, and it's not about being politically correct, but obesity has been implicated. So, you have to keep a trim body weight, healthy lifestyle. We know about smoking, we know about alcohol, and, when you get to a particular age, you have to make sure you get on the screening program. For example, colorectal cancer, it's terrible, it's nasty, but it's preventable. So if you start your colonoscopies by the time you're 50, or if you're found to come from a family that people have had diseases that are inherited alongside colorectal cancer, you can start at 45. So these colonoscopies would identify pre-malignant lesions. Colon cancer doesn't just appear from nowhere. It comes from a small lesion and it transits through to its very, very malignant state. So if it's caught at those early stages, you can remove the lesion or the polyp or whatever you may find, and that is that. So it's easy to do, but we're not picking up these low-hanging fruits.
And how can we do that now?
We're already doing that at the NSIA-LUTH Cancer Centre. So when we see patients whom fall into these cancers that are heritable, we encourage them to do genetic screenings, and we also inform them about the fact that their relatives could have some of these things, so they are aware. The awareness is really a huge part of what we're doing now. We have to inform patients, and you'll be shocked about what educated people believe when they come to the hospital. Even when you're speaking with relatives, you see people who will tell you that they take a lot of vegetables, or they take a lot of this and a lot of that as home remedies. And we need to regulate all these things and make sure that people have access to quality care.
Is it that there are no home remedies, verified home remedies, that can cure for cancer?
Well, you could say home remedies could cause some symptom relief. Okay, symptom relief might be if you're having a backache, or if you're having a headache, or if you're having some stinging effects in your hands and your feet. There are a couple of home remedies for those, but there are no home remedies that are as efficacious and as measured as the orthodox treatments that are available currently for cancer care. So we have treatments that have been used all over the world, treatments that have proven to be extremely efficacious, and these home remedies are just bandied about by charlatans who, at the end of the day, when they reach their wits' end, they send these patients to the hospital. And it's quite heartbreaking the way these patients come back after they've been with, you know, those home remedies for a while, and it just makes the statistics even worse for us.
Thank you very much for the education. I believe this is a very important part of the prevention. So now that you're armed with the information, please do well to share and take heed. It's one thing for you to have the information, it's another for you to make good use of it. That said, do you have any last word for anyone listening?
I think we need to take this really seriously, because, you know, we can't keep saying it was not my portion or it's not going to happen to me. There's a funny statistic that goes that we all know at least one person who's been affected by cancer. It shows us that, you know, the prevalence of the disease is really high in our environment, and denial will not help us to get past this. It's decimating our working force. Even if you don't have cancer, if you're taking care of someone who has cancer, you've automatically been pulled out of the economic workforce to become a caregiver. So it's a big problem we need to sort out.
Thank you very much. I was going to ask you in the course of the conversation how many oncologists we have in Nigeria. Let's not even get started.
I was trying to end on a positive note, but you know, there was a paper that a respected colleague of mine put out in 2016 about burnout among oncology health workers, and you should read that paper. It will break your heart. Cancer is not one of those, oncology isn't one of those disciplines where you can be emotionally detached from your patient. No, you have to go through the journey with them. You have to be empathetic. You have to share their worries. You basically have to give your all. So we have about 80 to 100 oncologists in Nigeria, and that number could be reducing. Could be reducing with each month that passes, dealing with these numbers that we're talking about. So it's a lot. It's a whole lot.
For a population of close to 200 million, 80 to 100.
Yeah.
Wow.
And dropping.
Wow. Nigeria, we hail thee. Well, thank you very much for the education this morning. And I decided to ask that question just to let you know that prevention is way better, less expensive, less draining than cure, especially when it concerns cancer care. So please take care of yourself and be mindful of what you eat. Yes, we know that economic situation sometimes might not exactly allow you to be very choosy or the luxury of some things, but be mindful of your health and wellness. You can check out NSIA-LUTH on Instagram and Twitter, and to have more information about the good work they are doing to get educated. And of course, if you need help, you can reach out to them on Instagram and Twitter, NSIA-LUTH. My guest has been Dr. Chidi Agakwuru, and he is a consultant clinical and radiation oncologist at NSIA-LUTH Cancer Centre. Thank you again. I wish you a day filled with information dissemination.
Yeah, thank you, Seun. Thank you for having me.
All right, we're done for now on this segment. We'll be back on the Curious Mind segment. That's for the children between 6 to 15 years of age. I think you should let them be a part of it so that they have fun and also learn. You're listening to Smooth 98.1.
And the rest will follow.
Right. Thank you.
Thank you.
Start with figuring out what does health look like for me, physically, mentally, emotionally.
What show is coming up next?
Really hard
a show for children.
Healthy mind,
Yeah.
healthy
It's
body,
called Curious
healthy
Mind.
life.
Are you
Soul
anchoring?
food.
Yes, I am. My
When?
show doesn't end till 10.